So good morning again. Thank you, Pak Lutfan, for the introduction. So I'm going to speak briefly about the potential roles of digital twin for pandemic prevention, preparedness, and response. Next slide. Now, a few weeks ago, I just returned from Geneva for the pandemic treaty negotiation. So WHO at the moment is trying to have an agreement, a conventions on pandemic prevention, preparedness, and response. And it's a long process, but the message is very clear that basically we are living in the age of pandemics. Whether we like it or not, there will be another pandemic. And it's very difficult to prevent another pandemic. So preparedness is the key. So we need to be better prepared for the next pandemic. The devil is in the details, but in principle, those are the messages which is coming out from the current negotiations at the WHO. Now, coming back to the current, the previous pandemic of COVID-19, next slide. So let me take you back to Indonesia, March 2020. We are now in December 2023. So we've been through 3 years of a journey within this pandemic. And now if we go back to March 2020, that's the first time that the government of Indonesia announced the first cases of COVID-19. In March, the president announced the first case of COVID-19. Now, a few weeks after the president announced, we were called by several high-level officials. So I remember a few weeks later, I was asked, Dr. Yodi, can you join a Zoom meeting? We need to hear your advice. I said, okay, fine. I'll get on the Zoom. So within 2 hours, I was on a Zoom meeting. I didn't know who was going to be there. And we opened the Zoom, and there were 6 ministers on the Zoom meeting. So it was a very high-level meeting, and we were surprised because it's usually difficult to meet ministers. It takes months to get appointment to meet ministers. But at that time, there were 6 ministers there waiting. And they have a very simple, very difficult question because they only had the first 2 cases. So they were just asking me, Dr. Yodi, should we lock down the capital city of Jakarta? It's $1 million question. That's a very difficult question to answer, to tell the government whether you should lock down the capital or not at that point. It's very difficult because we have no experience whatsoever. There was very little data, very little research on how effective a lockdown is. So it's very key to actually advise the government. So we didn't have an answer, and I don't want to give them oversimplified answer. So I just asked them, okay, can you give me a few days? I don't have the answer. So I asked for a few days, and I worked with our team. And it was very difficult because we didn't also what to do with very little data, very little evidence. So we just come up with a very rough model. Next slide. So it's a very rough model of Jakarta lockdown, which we made around April 2020. Very simple. I mean, that's the only thing you can do within 3-4 days. You don't expect much. It's just a model trying to see what happens if you don't do anything. What happens if you lock down as soon as possible? What happens if you delay the lockdown? And what are the consequences and what are the implications? So this was what we presented. And of course, they had many other questions which we cannot answer. I mean, they were asking, okay, if that's fine from a health perspective, but what is the political, social, economic implications? I don't know. I cannot answer that. You cannot get it from this model. This is just showing in terms of cases. So we were not able to address the concerns of the policymaker using this very quick and dirty model. But it was presented and it was taken to the president. But of course, then it wasn't really enough to recommend lockdown based on this. So it didn't really push for that. So as you know, after that, we different versions of social restriction and so forth, and that evolves throughout the pandemic. But that just gave an illustration of the difficulties during the pandemic of trying to make decisions during a large crisis like COVID-19 pandemic. Next slide. So I just want to share just 4 key lessons from our reflections throughout the COVID-19 pandemic. What would have helped and what would help next time if we are to face another pandemic from a decision-making perspective. And it's just 4. There's, of course, much more, but in the context of digital twin, I think for are potential contributions of digital twins. So we can discuss about anticipation through simulations. And then there are also issues in terms of real-time decision making. And then there's also an issue on collaborative resilience. And then there's an issue of adaptive educations. So I'm going to unpack each of these one by one, just to give you an idea of what I mean by each of these. Okay. Next slide. So first, anticipation through simulations. Next slide. So what I mean here is that it would have been useful if we could simulate various scenarios, considering factors such as the rate of infection, availability of resources, effective different intervention strategy. If you have that, then it would help the decision maker if you can simulate different scenarios. So that will be very useful. Next slide. And then it will be also useful if we have the possibility to do a comprehensive risk assessment, meaning we can identify where are the weak points in our healthcare systems, which we didn't identify, for example, in terms of the health workforce, in terms of the logistic and so forth, so that we can devise strategies to mitigate this risk before they escalate, which we did. I mean, we were overwhelmed in terms of hospitals, logistic, and so forth, because we did not manage to do this. But this could have been done if we had the possibility to do risk assessment through simulation. Next slide. And then if we have the possibility to do simulation, that would allow us to optimize resource allocation by identifying the most efficient and effective strategies. Next point. And if we have the possibility to simulate scenarios, then healthcare professional can respond more rapidly and effectively when faced with real-world challenge, because you have the opportunity to already simulate and anticipate before it happens. But this also didn't happen. But this is something that we can anticipate for the next pandemic. Okay, next point, real-time decision-making. So what do we mean by real-time decision-making? Now, during any crisis, especially large crisis like the COVID pandemic, the ability to make decisions in real time is really critical. It makes the difference between really effective interventions and spread impact. So for example, when the ministers asked us whether to lock down or not, you cannot say, give me 6 months, because that's too late. They want it next Monday. So you need really quick ability to be able to make decisions. So you need to be able to do it in real time. And we didn't have the capacity. It's something which perhaps digital twin can contribute to be able to make to support real-time decision making. Next point. Because digital twin potentially offers a virtual representation of our healthcare infrastructure. So we basically have a dynamic mirror of the physical system. We have a digital mirror of the physical system. Next point. Now, if we have this, then we have the potential, we have the possibility for real-time monitoring and analysis, which could empower our healthcare professionals to make more informed decisions more promptly, not waiting for too long, and considering factors such as bed availability, resource allocation, and effectiveness of intervention. Next point. And the ability to adapt strategy in real time based on evolving crisis is crucial. We need to be more adaptable, and digital twin technology gives us the insight to make this adaptation. So that's also another important points of potential of digital twin. Okay, next slide about collaborative resilience. Now, when we say collaborative resilience, we are talking about the ability of our healthcare system to withstand and recover from shocks and stress like a pandemic through a cohesive and coordinated efforts among diverse stakeholders. Because our healthcare system consists of so many stakeholders, and when we talk about the pandemic, you have even more stakeholders. Next slide, next point. Our healthcare is a multi-faceted ecosystem. You have healthcare providers, you have policymakers, you have researchers, and you have so many other stakeholders. So collaborative resilience recognizes that you have an interdependence of these components if you want to be resilient. Next point. And digital twin potentially can serve as a catalyst for bidirectional communication and foster collaborations among health professionals, policymakers, and researchers. Next point. And it does that by providing a shared platform for information and insight. So in a way, digital twin technology can foster collaborations because you have this shared platform. So you can collaborate, you have shared insight, shared information for the healthcare professionals, policymakers, and researchers. So that's the third one. Fourth one, adaptive education. This is the last one. Now, when we say adaptive education, it's basically an educational, a pedagogical approach which responds to evolving needs of learners and to ensure that our education remains effective and relevant in rapidly changing environment. And we experienced that during the COVID-19 pandemic. Things were changing radically within a very short time. So our education needs to adapt. Next slide, next point. Now, the pandemic basically highlighted the imperative of adapting educational approaches to unforeseen circumstances, things we did not anticipate. So we need an education system which fosters resilience in both the educators, the teachers, and the students, the learners. Next point. And the healthcare landscape is dynamic. So digital twin technology can facilitate the creation of virtual representation that mirrors this dynamism. So this will allow students to engage with real-world scenarios in controlled and adaptable environment. Next point. And also, adaptive education at its core is about continuous learning. Now, digital twin technology enables students to engage with evolving healthcare situation. So in effect, it also fosters a mindset of lifelong learning. Next slide. Okay, so those are some of the key points I would like to highlight, which are reflections for decision making during the COVID-19 pandemic. So again, about anticipation through simulation, real-time decision making, collaborative resilience, and adaptive education. And for all of this, digital twin technologies have potentials to contribute. So the way forward, next slide. What we would like to do with our collaborative project is to develop this connected curriculum on digital twin for health system resilience. This is built on this understanding that digital twin technology represents a transformative approach to strengthening the healthcare system. So if we integrate this into our educational framework, we basically ensure that our healthcare professionals are not just responders, but proactive strategies ready to face uncertainties of the future because they go through all of the simulations. Slide, next point. And a connected curriculum on digital twin technology becomes indispensable tool in preparing our care professionals because it equips them with the skills to navigate through different complex scenarios and also foster a mindset of anticipation and strategic planning, not just reactive and responding. Next point. And a connected curriculum on digital twin technology ensures that our graduates are not just proficient in their individual roles, but also equip the skills to collaborate seamlessly across discipline, different stakeholders, coming back to the concept of collaborative resilience. Next point. And with digital twin, which gives this opportunity for simulation-based learning, it provides a practical and engaging method for students to actually apply theoretical knowledge by exposing them to simulated healthcare scenarios. At the same time, we cultivate their critical thinking and also their decision-making skills with all those simulations. And last point, basically, at the end, the integration of the twin technology into our joint curriculum symbolize our commitment, our investment in the adaptability and future readiness of students. Next slide. Thank you. Assalamualaikum warahmatullahi wabarakatuh.